Hello, and welcome to another episode of Boundless Body Radio. I'm your host, Casey Ruff, and today we have another amazing guest to introduce to you now. Barbara Scolnick, MD, is a graduate of Columbia University College of Physicians and Surgeons and board certified in internal medicine and addiction medicine. Barbara developed the ketogenic and ketamine treatment for anorexia as a pathway out of anorexia to help her niece, who is our former guest, Caroline Beckwith, we hosted on episode 759 of Boundless Body Radio, to recover from her disease of anorexia. Barbara is the author of 2 seminal articles on the ketogenic diet and ketamine for anorexia, including groundbreaking case studies reporting remission from chronic anorexia nervosa. She is the co-author of the book Exiting Anorexia, a revolutionary keto metabolic treatment for anorexia from the perspectives of the first patient, the physician researcher, and the patient's mother. She is also on the medical and scientific advisory board of Anor-Exit, an online program that calls for a ketogenic metabolic therapy to reverse eating disorders. The mantra that all food is good food often fails to achieve a sustained recovery, while ketogenic metabolic therapy has been shown to substantially weaken or even eliminate the anorexic voice, anxiety, and behavior. Barbara Scolnick, what an absolute honor it is to welcome you to Boundless Body Radio.
Oh, thank you so much, Casey. Thank you for inviting me.
Oh, it's such an honor to have you. I'm so glad that I came across you and your work through your niece, Caroline, who is absolutely lovely. We had such a great chat with her. I was so happy to hear that she won the award, the Fresh Start Award for 2024, and was given a $10,000 grant that she can use to advance metabolic psychiatry, this emerging field that's just so wonderful. And so before we deep dive into you and your story and how you came about this, how proud are you of Caroline and her work and her winning this incredible award?
Oh, Caroline is amazing. I mean, I've known Caroline since before she was born in utero, and she's always been amazing. And then she fell into such a horrible illness for such a very long time. And you could still see she was still Caroline. You could see it in her eyes, but the suffering was so intense for so many years. And then to emerge, I don't know if she told you, she just got married. Did she tell you that?
No, that's awesome.
And I married her.
Wow, very cool. What an honor.
And he's great too. I mean, her life is she's really an amazing person. And she always was. And the way she did this treatment, we really, formed it together. It just was great. It's the best thing that ever happened to me by far. I mean, medically, completely the best, but personally too, to take part in it with her was just fantastic.
Wow, that's amazing. I've made the point that these people who have won this $10,000 grant given out by the Bazooki Group, they're already so resourceful and they're already so passionate. They've been sharing their message in any way that they can. Don't you agree with me when I say that this $10,000 is going to go so far, with each of these people? Don't you think it's just going to be every dollar, every penny is going to be used to the absolute maximum?
Right. I do. Well, I'm always amazed by the Bazookis that they are putting all these seeds out, and they're doing it so smartly. They're doing it to people who are already committed and going to make it grow more. And they're finding basic scientists. They're doing it around the world. It is amazing to watch.
Yeah. It is. We were talking offline. It's miraculous. These angels came out of nowhere. Unfortunately, their son, the Bazooki family, their son, came down with bipolar, and they did everything to see, Matt Bazooki do presentations and show the laundry list of all the medications and treatments and flying all over the place, and nothing seemed to help. And they stumble across, Dr. Chris Palmer, and now all their philanthropy is going towards metabolic psychiatry. And you're seeing the results. Like you said, they are as smartly as possible getting money and resources out to people who are going to do amazing things with it. It's so cool to see.
Right. No, it's I think that the ketogenic diet has a little life of its own, and it's over 100 years old now, and it kind of went through this once before. I don't know if you knew about the Charlie Foundation. Did you know about?
Yeah, of course.
So it kind of blew out. It was a treatment for epilepsy in every hospital in the country. It was the only treatment. There were no other treatments, and then it slowly died away, and nobody was doing it. And then Charlie got epilepsy, and his parents found, like the Bazookis, and they were also wealthy, not as wealthy as the Bazookis, and they once he got better with the diet, they said, no one told us it could be a diet. That same shock, a diet, and after all these meds and all this stuff. And they started it, and it grew, and Atkins then came in and said it was a weight loss diet. And then it started to but know that the seizure part started to slowly die away. People didn't really realize it was effects on the brain. No one knew what to make of it. And then Matt Bazuki got well.
Yeah.
And it was like a match was lit. And Caroline and I were just there at that time.
Wow. Yeah. It's absolutely amazing. The Charlie Foundation, founded by Jim Abrams. I really regret that I was not able to, ever talk to him. He just passed away maybe like a month or two ago. But yeah, famous for, I mean, he directed the movie Airplane and eventually made a movie all about, epilepsy in his son and all the wonderful work that he did. And you're right. The ketogenic diet is kind of getting a life of its own. Like even in this last month, at a place where I collect spring water, twice separately, 2 different hockey games I went to go watch. Just random places at the grocery store. I've had people mention the word keto or carnivore, and they're like, "Oh, my parents do this, and their joints feel way better, and I'm trying this in January." And like, people are starting to figure this out and find out about this. Is actually quite amazing.
Right. It is. It is. It is. It's
Yeah.
an amazing diet. It's an amazing thing.
Yeah, I agree. I think it was Travis Christofferson that wrote something about like the truth eventually, slowly, but eventually is going to come out. You cannot suppress it. You can fight it. You can try to hide it. You can cover it up with prescriptions or whatever. But eventually, enough people are going to find this diet. And it's certainly been my experience that a lot more people are learning about this. Pretty cool.
Right.
Yeah. It's amazing. Well, over the years, I've had different ways of trying to get people interested in a low carbohydrate or ketogenic diet. And, at the very beginning, I would tell people like, wow, this is a cool diet because it helps people lose weight. And then it was like we were learning about type 2 diabetes and like, wow, this is an amazing diet because it can reverse type 2 diabetes. And then we learn, about all the metabolic psychiatry. And this is amazing because it helps bipolar and Alzheimer's and all these amazing things. This is my new favorite way to talk about this diet. A ketogenic diet could potentially be helpful for anorexia nervosa. That is crazy to say. And it gets people's attention because you're telling them a very restrictive diet can be very helpful for a condition that everybody knows is all about restriction, and you should never recommend restrictive diets. But it's helping people. Like it can help people lose weight, but also help anorexic people gain weight, restore weight, but also fix their brain. It's remarkable.
Well, Caroline was absolutely the first person to try it, and I was terrified. I was terrified because I know it's a weight loss diet, and the last thing she needed was to lose any weight. The other thing was she was eating mostly carbs. That was all she ate. Mostly, incredibly low calorie carbs or no fat carbs or carbs filled with Splenda or black coffee with a lot of Splenda. And I thought, I'm going to take away the one thing she eats and she'll eat nothing. And I actually really wanted to do it, and Caroline and both wanted to do it. I wanted to do it in a hospital with supervision, with under support, but nobody would do it. Nobody would come close to it. I was even asked sometimes when I would, offer it at eating disorder conferences because it was just an idea. I mean, I didn't know if it would work, but they would ask me to leave and say I was disruptive and, talking about restriction, and it's not what people need to hear. And it was just the antipathy to it was incredible. And then that's why I really give her amazing credit, because she went and she trusted me. We trusted each other. And I trusted if she started to fall apart, we would get her right in a hospital. And I remember her, as she started to say, the voice is quieter. It's quieter. But I had a gut feeling it would happen, but I didn't know it would happen. And it was all based on the reading of the guy, Russell Wilder, who described it for seizures. See, I was just reading and trying to find a way to help Caroline, and I kept focusing in on a couple of things, and it all kind of led there. One thing was, she reminded me, well, there's a paper about it, that it would be a normal, I don't know if she told you about it, the adaptation to flee famine.
I learned about that from, I believe, your appearance on the Metabolic Mind podcast, where you talked a little bit about that. That's fascinating. It's also in your book as well. I believe in the first chapter.
When I read that paper, I just fell in love with it because I knew Caroline. I knew it wasn't from trying to look like a model. It wasn't from any big disruption in her family. It wasn't from any of the usual things that they were saying. Talk about your mother, talk about your father, talk about how anxious. And she didn't have that. She was just a normal, happy, athletic kid, went to summer camp, went on a diet, and never got out of the diet. She fell down into a metabolic hole and she couldn't get out. And it seemed so metabolic to me. So then I read that article and it said, why do these girls who often, they're not often the people who they say the models and the ballerinas, why do these girls do this? And she said, she was an evolutionary biologist, the author and the therapist. So she was seeing these kids one after another, and it struck her. And I actually talked to her and became friends with her. It struck her that it would be normal in a certain way. And the way that it was normal was when we were hunter-gatherers, we'd face episodic famine. And what would be better if somebody was in that little small nomadic group and said, I'm not hungry. I feel great. As a matter of fact, I want to move. I want to exercise. Come on, gang. Come on, nomads. Come with me. We're going to walk. And if there was food, they'd give it to other people. They were not going to eat it themselves, give it away. And what they were doing was leading the tribe to, it was an evolutionarily conserved way to lead the tribe out of hunger, out of famine. And I thought, that's it. And I started reading about animals and what they do in famine. And of course, they migrate or they hibernate. And I was reading deep into the literature of and early humans migrated, and probably some humans are still migrating. Well, now we're having climate migration, but in the olden days, we had famine migration. So how does the brain know there's a famine? Why does she think there's a famine? That became the question. What's not getting in? And there was this amazing study about hibernating animals. And we all know what causes the animals to hibernate. And Caroline struck me as being in almost a rogue hibernation. She was always cold. You get extra hair on their bodies. People with severe anorexia will keep warm. They do better in the summers. And the part that was made odd is that they move rather than hibernate. But it was like a rogue hibernation. So I studied what makes animals know that it's time to hibernate. It's a simple question. And there's a whole body of people who's doing research on it. And they take these animals and they put them in the lab and they figured out there are things that make sense. When the temperature gets cold, the animals hibernate. When the days get shorter, the animals know to hibernate. And they usually eat a lot before the hibernation and then they go into hibernation. But there was one thing that they hadn't noticed, and it was one of the powerful influencers. It was a change in the fat of nutrients. Nutrients in the spring have a different fat content than nutrients in the autumn. And if he gave them a diet that was still reminiscent of the outside spring diet when things are flowering, and made the laboratory dark and cold and waited for them to hibernate, they would not hibernate.
Wow.
It's a signal. It's a major signal. So I just thought it's fats. Fats are the signaling agent that's messed up. And how are we going to fix those fats? And it was really years, I kept thinking we'll find an individual fat that's malfunctioning. And then I remembered a journal that I had heard about in medical school that the high fat, so you don't have to worry which kind is it, this fat or olive oil fat or coconut oil or this fats, just fats, that a high fat diet is a treatment for seizures. And I actually went to the Harvard Medical Library because I live in Boston, and I found the original article because I like history. And I read his words, and it was amazing because he was describing this before anybody knew about the Krebs cycle and the cell, all the things we learn in biology. That wasn't described. He didn't know any of that. He was just a doctor in Mayo Clinic, and it was all empirically observed. Do you want to hear his observation?
Absolutely.
Okay, this is what he observed. He was a generalist because that's all that there were. There were nobody was an endocrinologist or neurologist. He saw everybody. He was super smart. He was at the chief clinician of a brand new hospital called Mayo Clinic, and it had just opened. And he saw a lot of kids with seizures, and there was no treatment. So he would just be sad with the parents. And the parents started telling him this. They started saying, when my son or daughter fasts, for 2 or 3 days. And there were communities that were religiously fasting around the area. So they had a lot of these. They said the seizures stopped. And he had no CAT scan to order, no, he just listened. And then, so he said, I wonder if that's true, if they're telling, but he heard it over and over again. So he admitted 3 of these kids to the hospital. He fasted them. And he said, it's true. Their seizures go away when they fast. And then he also treated diabetic kids. And in those days, there was no insulin. So they all died. And it was very empathetic. And I really would have loved to have met him because he saw these kids, but he tried to keep them alive as long as possible. And he knew what happens in diabetes. And he knew that as their ability to make insulin got less and less, they got thinner and thinner. They were metabolizing their own fats, and then he would be checking their urine and their blood and trying every day to feed them and regulate it just a few more weeks to have months. And he also knew that there was a medicine coming, but nobody had discovered it yet. So he was trying to keep them alive for as long as he could. And then at a certain point, ketones would appear in their urine. And he knew that he wasn't afraid of ketones, but other doctors were, because 24 hours after they started to appear in high numbers, the child would die. So doctors thought ketones were terrible things. They were, harbingers of death. They were evil hormones. But he said ketones just accompany fat metabolism. That's all. When you're metabolizing fat, you form ketones. They're not bad. They're not good. They're just a chemical. So he knew that. And then he had this incredible moment. And he said, I wonder, and this is before seizures, CAT scans, he said, I wonder why these children with seizures do better when they fast. And he said, maybe, I love the word he used because it wasn't technical. He said, maybe their brains prefer to be bathed in ketones. And so when they're fasting, they're getting ketones in their blood. So their brains are sitting in a lot of ketones. I have no idea why they do better, but why not assume it's that? And then he said, suppose we just reproduce it. Suppose we give them, instead of starving them, we give them a food that's only fat, no sugar. They'll have to use their ketones. They'll have to use that fat. They'll have no choice but to use their fat. They'll form ketones and their brains will be, and he used the word, happy, and stop seizing. And I read it over and over, and I said, maybe Caroline's starving because her brain prefers to be bathed in ketones. Just exactly, I followed his exact words, just replaced anorexia every time he said seizures. And he ended his article with, it's worth a try. So he admitted a few of these kids, gave them he devised the keto diet, which he knew very well. And because of his work, diabetes, he knew all about vitamins and minerals and replacing all that stuff. And sure enough, they stopped seizing. It was like and Caroline had almost the same sort of thing, like this crazy reasoning that doesn't sound scientific at all, but it had truth on its side. And we're still trying to figure it out. And I don't know if we ever will figure out why it works. Because when you think about it, most of the time we discover medicines, we're so used to a pharmaceutical develops a little chemical, they patent it, they study it, they do animal trials, they try it in human trials, they take it to the FDA, there's a new treatment and they get a lot of money and everybody's happy. But this was totally backwards. He had an observation and he had just deductive thinking. Suppose this, suppose that, let's try this. And it's so backwards that nobody's been able to do the back work now, because every time we try to see why does it work biochemically, we really don't know. There's so many things going on. It wasn't discovered in that way. And but it works. And it's amazing. It just is.
That's incredible. Okay, I'm going to cancel all of my clients for the rest of the day. I'm not going to see anybody else. If you have another like 10 hours where I can just sit here and listen to wonderful explanations, that was incredible. I could listen to you all day long. It's absolutely amazing that you found that. And we knew even back thousands of years ago, right? Like you hear stories about either Roman or ancient Greek cultures where if somebody did have seizures, they learned that you could put them in a cave for 2 or 3 days and not feed them, and that would help them. So they at least had some inkling. And you mentioned like the religious side of things where people were doing fasting for other reasons and noticing these other side benefits. And it's only later that it's like you explained, like, oh, the science, the mechanism, we might not ever fully understand it, but it starts to make a little bit more sense.
Right. It's in the Bible. There's a reference to it in the Bible. It was that same guy, Dr. Wilder, who said that. It said for the problem of seizures, it takes deep prayer and fasting.
Wow. Wow, that's amazing.
Yeah.
I wanted to also go back and learn about your own personal story. It sounds like, I mean, you mentioned in med school you were kind of looking up some of these studies or found some of these studies, or was that
Well,
much after? Like, what was your background in internal medicine that eventually led you to this driving desire to help Caroline?
oh, well, the driving desire was all just familiar. Her mother's my twin. She probably told you that. We're identical twins. But but in medical school, it was taught in neurology, and I always liked neurology, but I also really liked the history of medicine. I liked how things came around. So when they said it was like a very passing, it was like a half a day we had talk, maybe less, on a diet treatment for seizures. And I just thought, isn't that crazy? But it stuck in my head. And then after medical school, I just trained in internal medicine and I had a very non-illustrious career for sure. I just worked in ERs and outpatient clinics and worked part-time and raised my kids and, really didn't think I'd ever make any kind of contribution. I actually used to feel bad about that. I thought, oh, when I applied to medical school, it was so hard to get in. There were people trying to get in to avoid the draft. It was those years, and I thought I'm such a waste of a doctor. All I've done is work part-time in a clinic, and each day that it's my day to be on, I think, oh God, I'd much rather walk the dog and do something else. But I did all that, and then got interested in addiction, which was because I could help people with Suboxone. I could help people very quickly, and I like that. And then Caroline, we went on vacation, and Caroline at 14 was no longer who she had been a few months earlier. And I saw all the agony of it, and I just thought, I saw how they were treating her, talking about her parents, all this therapy that made no sense. I think like my great gift was that I had never liked eating disorders. And so I had avoided it. So I didn't know what the thinking was. But the fact that they were asking her about her parents just struck me as so odd. You have a sick kid who clearly is starving. Why do you think that's going to give you an answer? Then over the years, of course, learned a lot about how they think, and a lot of what they think I don't agree with. I especially don't agree with all food is good food.
That's very interesting. Commenting on some of the treatments, like when we were talking with Caroline, she described, outpatient, what that was like, inpatient, what that was like. And you're right, especially with the outpatient, it doesn't seem like it hardly does anything at all. Inpatient, maybe a little bit more, but never really addresses the root cause. And you see, like Caroline explained, so many people repeating. And so, I mean, again, you not being drawn to eating disorders in the beginning, but looking at some of the standard treatments, like, I don't know, talk therapy, counseling, whatever they were doing.
Well, it was cruel. It
Yeah.
seemed very cruel. I actually volunteered at an eating disorder clinic in Boston because I wanted to understand it better. I wanted to know. And they would not let parents in except for like 20 minutes a day because the parents were thought to be toxic. Now that's got to be nuts. I
Wow.
thought, you have a parent, your kid, and you have to sign a release for your kid to get an influenza vaccine. And here your kid has a fatal illness and you're asked to leave the room. We don't want you. So that was cruel. And the other thing I kept hearing is that there's epidemic of eating disorders in young women because of the models and because of the thin, the models. But yes, there is an epidemic of eating disorder, but a lot of things have changed along with thin models, especially the way we eat. We ate fat in the 1950s and 1960s. We ate them in the 1920s and 1930s when anorexia was a very rare, and anorexia was around. It's been around since the 1800s, but it was rare. But since we've adopted the great American high carb diet, it's not rare. So you could look at the diet rather than the culture, and that may be the culprit.
Yeah, that's very interesting. You also wrote about that in your book, the original kind of diagnoses that were done, I believe in Europe, maybe France, where there was a case series of a few women that were diagnosed. And you did kind of get that impression. It was interesting to talk to Caroline and hear her experience. It almost seemed like, yeah, there was something else going on. Like maybe it was helped by other people are noticing that she's losing weight at age 14 and that's giving you the dopamine hits, but that didn't seem like the primary driver. So that's interesting that you commented on that. Something else is definitely going on.
Right, right. No, it's still a mysterious disease, and it's still a horrible disease, and it's still a long haul. And I don't know if Caroline talked to you about the ketamine part. She must have, did she?
She definitely did, and that sounds like such a fascinating component. I was definitely going to ask you about that as well.
Because with the ketogenic diet, I remember all the calls she'd make because you know how Caroline's very intense. She calls right away, and she called and she said the voice is quieter. It's quieter, and then she called again and she said, I did a strange thing today. What did you do? And she said, I laughed. I realized I hadn't laughed. And she said something was funny and I laughed. I was with my friend and I was able to like focus on what she was saying. I wasn't thinking I have to go exercise. I'm too fat. I'm too fat. And it was funny and I laughed. But then I know she was something. But then she said, the voice is still there. It's quieter. I could push it away, but it's still there. And I want it. I want you to kill it. That's what she said. We have to kill it. And then, so I thought, I trusted her. I didn't want it to come back. I wanted the voice to be gone. And so I started to think of like another modality rather than, well, now you should go into therapy, because I knew that wasn't going to work for Caroline. She wasn't going to do that. It just hadn't worked in 15 years. So two things happened. One is over the years of my studying this, most of the people really did ignore me or be overtly hostile. But there were some researchers who weren't. And I don't know if Caroline told you about Dr. Chi.
I know that you wrote about it in the book. She was the one who originally came up with ketamine. Is that correct?
Yes, she is, and she is a basic scientist. She's not an MD. She works with animals and she studies activity-based anorexia. And I told Caroline that there's an animal model for anorexia, and this woman is the world's authority on it. And she studies it very carefully and then dissects the brains and looks at the hippocampus and tries to look at why some animals become anorexic and some animals don't. And some indications led her to believe that ketamine might be helpful. But it's an amazing model. It's such a strange and bizarre model. And Caroline was so happy to hear that there was a model for anorexia. She said, it's a rat. You could do this to rats. She said, I like that because when I'm anorexic, I'm sort of in a rat brain. It's just this brain. And I don't know if she told you the model or if you want to hear it.
I would love to hear it. It's something that I don't know very much about. I told Caroline that in the past, I'd heard of ketamine, but it was more like a party drug. Like I'd never taken it, but I knew people who had. And I don't know if it's an up or a down. I don't know that much about it or how it's used in therapy. I knew it's used with an IV drip, but besides that, yeah, I would love to learn about that.
Okay, so first I'll tell you the activity-based anorexia, and then I'll tell you the ketamine. And they're both amazing stories, but the activity-based anorexia, and all these things are old. That's the other thing. So it was 1960. Now that's old.
Wow.
1960, a big lab in Pennsylvania was doing nutrition studies. You know, they were still describing some vitamins then. So they'd have these rats in these cages and they'd give them different things and they'd find what they needed. And they got a grant, but it was a small grant. It wasn't much you could do with a couple of $1,000s to improve their lab. And I'll give you a test. They did improve their lab. They said, okay, what can we do? We can't do much with, a couple of thousand, but we'll do it. They improved their lab. And then what happened is they continued their studies. Their studies were to give the animals, at this time, their study was giving the animals a little bit less food than usual, or actually feeding the rats during the day, because rats only eat at night. So feed them during the day and change their feeding pattern, limit it a little bit, like stress it. So they were stressing the rats with their food. They improved their lab. And then this thing happened. Their rats started to die. lots of them. And they thought they were infected or something had come into the lab and blah, blah, blah. They finally put up cameras and then they figured it out. And then they wrote a paper. So here's the quiz. What was their improvement? Do you have any idea? So nuts.
I can't think of any. It's fascinating.
I know. This was what they did. They bought each rat, because they only had a few dollars, a little running wheel. So it'd be a happier rat in their little. And what the young female, some of them, young female rats were doing as their food supply got slightly stressed, just slightly, is they would start to run, they wouldn't eat, and they would run themselves to death. Isn't that amazing?
That's wild.
And that's called activity-based anorexia. And it needed both. If you give it it needs to have the limited food supply and it needs the running wheel, both factors. And if you take either one away, the rat is fine. If you take the running wheel away, it'll just eat its food. It may lose a couple of pounds if you're giving it a little less, but no big deal. But these women, these lady rats, so it is more genetically in women. Some of them, so they wrote it up because it was so odd. And it was foraging. They're looking for food, maybe that's what they're doing. But it over decades, it slowly got recognized as a model for anorexia. So Dr. Aoki would test it on many, many different things, and she'd do all sorts of different experiments and all sorts of different brain dissections. And she was making she saw it as a medical disease. There was no question in her mind that it was anything other than that. And she was finding, looking for things that helped. So and then you want to hear the ketamine story? Because that's
Yes, absolutely.
See, I was much more of a historian than a doctor. I like the history of medicine more than I
I
like
love this. This is amazing.
history of medicine. So this was the story. Remember PCP, angel dust?
Yeah.
Horrible drug, horrible thing.
I
But
remember like in their program or whatever, which is one of the most failed anti-drug programs ever. They would say like if you took this, you would like jump out of windows. Am I
right,
remembering the right one?
right. They did.
Okay,
People did jump out of windows. People
got it.
also killed other people.
Got it.
But at one point in the 1950s, it was a legal drug. It was an anesthetic, and people would take it for anesthesia for major surgery. And it was, but pretty soon they started to get the reports of these horrible effects. And then it was banned. It's banned around the world because it's like, it does like two horrible things together. It makes you feel all powerful and it makes you feel paranoid. And those are
Mhm.
bad combinations. So they took PCP off, but the drug company was very upset because they wanted a new drug. And so they tweaked it and they developed a drug and they called it ketamine. It was a little bit different, but this one they were going to test very carefully, and they did test it very carefully as an anesthetic. And some people, when they emerge from their surgery, would say, "I do have like a dissociated feeling. I felt I was floating or flying, but it wasn't bad." Nothing like PCP, but that was its origin. So it was approved, and it turned out it was phenomenally useful. It was approved right before, as Vietnam was getting heated up, and it had a lot of things that made it very, very good anesthetic for a war zone, because people never stopped breathing. You breathe through it. So you don't need to be a doctor or a nurse to give it. A medic could give it right in the field. It works very quickly to give pain relief, and then you could evacuate soldiers. So it got huge use and probably saved. It's the World Health Organization rates things that they call essential drugs. This became an essential drug because it's cheap, it's easy to give. You don't need to even be in a hospital. You could be out on the street. It hardly ever kills you. You have to you keep breathing right through it, and it's very good pain reliever and anesthetic. So it was perfect. And then it entered its next life. The GIs came back in the Vietnam era to the country, and some of them liked the dissociated feeling. They liked it. So they started to actually use veterinary ketamine. That was the first one abused. And they abused it every way you can abuse it. They snorted it, they injected it, they took it
Wow.
IM, they ground it up and took it orally, and it became a big college, drug scene. And the Actually, the US did call it then a Schedule 3 agent, capable of abuse. And that is what
I was going to ask if that's what it is today.
that's what it still is. And you haven't
Got it.
taken that thing away. But it was the guy who had developed ketamine. His name was Joe Domino. And he was a physician and a pharmacist. And he continued to work at drug abuse clinics as a because they wanted a pharmacologist there. He was a psychiatrist and a pharmacologist, and he would tell what drug they were abusing, mostly heroin, cocaine. This was like in the 80s or early 90s. And he said one girl came to him and he never forgot her. He said, what's your drug of abuse? Are you heroin, cocaine? What are you using? And she said, I'm using ketamine. And he said, ketamine? I developed ketamine. She said, I have to take it every 2 weeks. And he said, oh my God, what's wrong with you? And he said, this is such a beautiful drug and you're abusing it. He said, you need therapy. Why are you doing this? And she said, I'm doing it because I'm depressed. And when I take this, it alleviates it and I could go out and live a life. And he said, well, that's crazy. You should be on an antidepressant then. And she said, I am. It doesn't work. This is what works. And that was one of the first reports. And he said, stupid me, I didn't listen. Because it was another like 15 years later that people started to say, more and more reports. I'm not abusing it. I'm taking it for antidepressant. I'm taking it because it works. And then they finally studied it. And so it's the same backward story. They got it from the patient. So we still have no idea how it works, but or not much of an idea. But it's now used as an antidepressant. So I knew ketamine as an antidepressant. You could take it IV, you could take it IM, you could take it orally. And Chia Aoki had found that it was useful for the lab rats. If she gave them a shot of ketamine and put them in with the running wheel, they were nonplussed. They did not run themselves to death.
Wow.
So I thought it was worth a try. I mean, it was totally serendipity. I had no idea if it would work or not. I thought if you're a little depressed, it may help that. But I wasn't afraid of it. And Caroline wasn't at all afraid of it.
Wow. That's fascinating. Are there any side effects? It's hard. It sounds like it's hard to abuse. Almost like I haven't done any, but like psychedelics where people say like you kind of can abuse them, but it's not very pleasant. Like you wouldn't want to have a lot of like bad trips. Is it similar to that?
It's pretty similar to that. I think the Schedule 3 is a mean thing that came out of, when we were worried about abuse, but it's really not that abusable. There are some side effects, but it's mostly dose related. So like, if you give too much, you are going to get general anesthesia, but you don't want that. If you give too little, you're just going to sit there and get nothing. So what they want people to get is some sort of mild dissociation. And that seems to be what is the antidepressant property, whatever it is tied into that dissociative state. And I think it's a really pretty safe drug. I know, what's his name, who was on Friends, who just recently died of ketamine.
Oh, Matthew Perry. Oh, did he die of ketamine?
Yeah.
Oh.
But someone who was a ketamine provider told me, like, Matthew Perry took huge doses and he still didn't die. He had to get in the hot tub and he drowned. So it really is a pretty safe drug, but and I wasn't worried about that part of it for Caroline. I just thought it might not do much, but it kind of that's when it all blossomed. Now it's gone. The anorexia is gone. And that I'd love to see tried more.
Wow. Wow, that's so fascinating. Okay, so my wife has a very similar story to Caroline. It was about the same age. She had kind of the same thing. It was like you start running and she developed an eating disorder. I think she spent like one day in an inpatient, treatment center and was like, yeah, this is not for me, and left. But she did some outpatient stuff. And so I'm very close to somebody who has experienced that. And I asked Caroline a question based on my kind of biased experience of dealing with my wife. Like I've witnessed a ketogenic and kind of a carnivore diet help my wife immensely. And it's confusing to her family where it seems like I'm putting her on this restricted diet and I'm not doing anything. I'm not putting her on anything. It's what she chooses to eat. And I see that it's gotten better, but I also see that the voices, they're not fully gone. Like it's from time to time, things bubble up. And so I asked Caroline the question, like, the ketamine treatment, it must have been nice to help kind of quiet the voice further, although it's always still kind of in the background. And Caroline was like, well, actually, no, my experience has been like this voice is gone, and it's been gone for a long time, which really caught me off guard. Do you think, from your experience and the studies you've done, is the ketamine that kind of like nail in the coffin that really makes
Yes.
this thing like really go away?
I do, and I wish it were being investigated. That's the bazookies are not funding ketamine research because they're keeping laser focused on ketogenic, which is great. But without funding, it's hard to study it. But we've seen a few people like that. Very few, because ketamine's expensive, and a lot of people get better enough with ketogenic or they stops. But I think it does. And Caroline, I feel like I'm bragging about her, but it was Dr. Calabrese. That's how I found her. I just went through ketamine clinics. There were lots of them treating, depression, and it's Hartford. She's right outside Hartford. I'm in Boston. Caroline's in New York. Was perfect, And but after the usual depression treatment is 6, but it varies. It's just kind of made up. The NIH did this when they finally studied it after listening to all these people saying it got better, and they studied it. They did 6 doses over like 2 or 3 weeks. That's what they did. So that's what most of the people do. And that's what Dr. Calabrese was doing. She planned 6 doses over like, I think 3 weeks or something. And after the 3rd dose, they took the IV out, and she said, how are you and everything. And Caroline said, Dr. Calabrese, you better clean this room really well, because whatever has been living in my head for 15 years just jumped out.
Oh my goodness.
And it did. And we've seen that again. Another person who had it for like 20 years, it was gone. It got a lot better with the keto diet. When she took the ketamine, she took the 6 weeks because she's a rule follower, and that's what and it is gone.
That's incredible. Wow. Yeah. I hope Dr. Calabrese like really saged the room pretty well afterwards to make sure all those spirits were exercised. That's that's absolutely incredible. It's amazing that research has been done. And reading her description in the book Exiting Anorexia of like the first time, it helped. It was lessened, but it was still kind of there. And after the 2nd and 3rd, like it was literally gone. To this day, has not come back. Is so incredible. Yeah, that's amazing. I really do hope more funding somehow makes its way in this direction, because it sounds like this could be very helpful for a lot of different things.
I know it really could. I think it could. Well, your podcast is doing its part.
We're trying. We're trying. You making this such a captivating episode is really helping as well. I want to go back to the diet side of things. And again, for somebody who is just hearing this for the first time, they're thinking like, okay, a ketogenic diet is already restricted. We're restricting an entire food group. People think that the carbohydrates are so essential, and if you cut them out, you're going to be obsessing with them. And interviewing Caroline was the first time it really registered that like by putting somebody on a restrictive diet like a ketogenic diet, you're playing into the strengths of this person anyway. I'd never considered that or thought about like rather than say like, oh, sit with the cupcake and nibble the cupcake and like think about cupcakes. It's like this person may not ever want to do that. Can you explain what is the mechanism behind why a ketogenic diet is so helpful for eating disorders?
I don't know. I think it has to do with, it may be that we could one day find a particular fat that's in there, but they're getting more fat, and that's crucial. And they're simulating starvation. It's a diet that looks like you're starving. When you're starving, you just metabolize a lot of your own fat, so you get skinnier and skinnier and skinnier. So ketones are formed, and your brain only has 2 sources of energy. It has glucose and it has ketones. That's it. So when there's an overwhelming amount of ketones and not much glucose, it flips to being almost all ketone generator. So I think of it as like a Prius car, like a hybrid. If you're riding in it, you don't feel the difference, but the whole inside has changed tremendously, whether it's getting it. And when you flip over into a ketotic metabolism, your brain, going back to Russell Wilder, your brain gets happy. And maybe these people need to be in a ketotic. There may be biochemical reasons why their brain does function better in ketosis. There's a power that comes from first starving. There's a power that comes from first entering into anorexia. There is. And there's a power that comes from when you feel like you're on top of the world. And that power is probably ketones. It's probably joined in with the sports people when they feel better in ketosis. Maybe their brains don't, maybe some of these people who are prone to get anorexia, their brains are sluggish and not so good when they're on their glucose metabolized brain, and their brain is intact and faster and stronger and happier when they're in ketosis. But it was a complete shock. It was. And I don't think you have to, learning from the seizure kids, those kids did not stay on it forever.
You hear that all the time.
They would go back to eating regular and test it. If they seized, they go back to ketones. And I think it gives you this tool that if you start to have those bad feelings or anxieties or yuckiness, go back. It's an okay diet. You could be on it for a long time. It doesn't hurt you. It helps you. And then if you feel like you're better and don't need it, there's a healing that does happen. That little metabolic hole that she fell in at age 14 does eventually close, I think.
That's so interesting. I mean, I remember she mentioned that you started by suggesting like add some MCT oil, which she was obviously very resistant to, adding fats and oils. And then it became like this butter, bacon, eggs, and avocado kind of style of a diet. And yeah, it surprised me a little bit as well that she said today she has a more open diet. She doesn't necessarily follow a true strict ketogenic diet, although I imagine it's still probably pretty low in most carbohydrates anyway. And she's probably eating a lot of those really healing foods. But you're right, it doesn't sound like, at least in her case and a lot of other cases, people don't necessarily need to stay on the strictest version of the diet forever. You can have that healing and go back to at least some tolerance.
Right, a lot. Like one of the patients who also had that remarkable effect, she said like she's not on a keto diet. You know, she eats everything. She goes out to eat. She has a very high powered job. She has to meet with people. And she said, and then somebody in her close family got sick and she started to feel these awful feelings of depression. And then along with it, like I'm fat. She said she instantly went back on keto and within 2 days it dissolved. Those thoughts dissolved away. So to have that ability to fight it off with that, to know that you have that you have that tool is really a nice thing, I think.
The arc of your career is so wonderful to feel like you were, helping people, not feeling like you were getting noticed, not feeling like you were making contributions. And then all of a sudden this happens and you go on this journey and all the research you've done simply to help your niece, to get to the point where you feel comfortable making that recommendation and then getting to the point that like you're actually doing research and you're contributing a lot to the community. Like, what has it been like to work with Lori Calabresi and Guido Frank, like all these amazing other people to like get this information out there?
Oh yeah, Guido. Like I remember because he was the first academic who. What happened was that we wrote the case report. People very, you had to really look hard to find it, but people did, especially parents of kids who were really suffering. And I would always say, I can't really treat you because it's still so new and liability, but why don't I talk to your doctor and I'll tell them and they could, and I talked to a bunch of doctors and they always would say, oh, this is very interesting. Goodbye now. Oh, restrictive diet. Okay, gotta go. And when I spoke to one parent called and they said, my doctor's Guido Frank. And I called Guido and I expected the same, nothing. And he said, tell me more. Tell me more. And it was just, he said, I hadn't thought like that. Tell me more. And then I texted him because I realized there was a ketogenic conference in San Diego where he is. And he said, I think I'll go. It's not far. And then he got into it. And then he's running and he has the ability. He has the academic credentials. He has the big lab. He has a big hospital to admit. He's just fantastic. He's been like the lead way to relevance and that's what you need. I know doctors think like that. They're cautious about case reports. They're especially cautious about case reports that come from somebody who worked in ERs and did not too much. But no, it's really like at night, I always say, see, to the guy who interviewed me and really pushed for me to get into medical school, I used to apologize to you. Why did you get me in? You must have made a big mistake that day. But now I say, see, I didn't let you down. He said, I see something good in you. You'll do something good.
Yes, you will. And yes, you have. Yeah, that's amazing. That's where I met Dr. Calabresi, her registered dietitian, Rachel, who's also amazing. We've interviewed them. I met Guido Frank there. And it's interesting. I'm so glad you went. I'm so glad to know that there are skeptical people were also like open-minded. And he
Right.
came to the Symposium of Metabolic Health 2024 and made a presentation as somebody who was skeptical. And like you're in a room where everybody's already drinking the no sugar, low carb
Right.
Kool-Aid or
Right.
whatever it is. But to
Right.
have somebody from the outside say, like, this is what I found, here's a case study.
Right.
Beyond that, here's the mechanisms. And he's going through and explaining the science and biochemistry. It's so
Right.
powerful to see all of that combined, especially coming from somebody who is not a keto low carb,
No.
zealot like I am. You know what I mean?
Right. He was very cute. I remember he said, when they would get better, I was always thought it was from my force of personality to tell them to eat. And now I realized just give them a keto diet.
Wow, that's amazing. I wanted to save time to make sure we talked about you and your own personal life, you learning about, diet and the power of a ketogenic low carbohydrate diet in, certain medical conditions. It turns out it's good for a lot of different things. So over the years, as you've been learning about this, what have you done with your own personal diet? How's that changed?
Okay, what it did is I briefly went on the keto diet to support Caroline, but I didn't stay on it. And then it's just now, it's month 4.5. I decided 4.5 months ago to really go on it. And I made an appointment with the neuro dietitian who was treating anorexic, who works at anorexic. And I said, just treat me like a patient. I'm just going in like a patient. And I did. And I make smoothies and for 3 months, I didn't feel anything. I didn't feel better. I didn't sleep better. I didn't have more energy. 3 months. And now the fourth month, it's really starting to kick in. And now it's like, yes, we are in hard times, but it isn't all black all the time. It isn't complete total darkness. There's a lot of hope. There's a lot of joy. There's a lot of happiness taking the dog to the park. It's like, a change. And that's given me, I had to see it myself. There's a part of keto because it's so available. It's a food, it's not a medicine you're going to take. You could try it yourself and see. But I would caution people now, I realize, wait longer. There's an adaptation period that is, I saw at like 2 months, if I didn't see something with a patient, or 2 weeks even, I think this isn't going to work. No, it takes
Give,
time.
give it time.
Yeah.
Wow, that's amazing. Did that clarity, that sense of optimism, surprise you?
Yeah, because I also think I'm not that basically an optimistic person. So I've always gone through life seeing the dark, but it's so much easier to see it as like, yeah, maybe this is going to work out. Maybe this is okay. Yeah. There's a lot of global warming. Maybe somebody will find some solutions, instead of like, oh no.
Yeah. No, I agree. When I took the step to be a little bit more strict on my ketogenic diet and I kind of, went more to the carnivore side of things, that is, I will tell everybody, that's the primary reason I stay pretty strict on that diet, is because the surprise, it took me a little bit, it was a little quicker than you, but like 2 weeks, 10 days, whatever it was, where the anxiety dropped out and things were just joyful for no other reason than like there's a bird and there's a tree and the grass is
Right,
growing and like
exactly.
things are okay. Like stressful things can happen. They don't affect me the same way that they did before. It was remarkable.
Right, exactly. Like the things you want to get out of meditation, you know.
Yeah,
And it
totally.
does go with all that. It does. And it's eating whole foods. And I like the idea. I mean, you have to like the idea that it's a food. It's not a chemical. I'm not sure if we've ever been chronically ketotic human beings. There's always reports that maybe Arctic people were or are, but nobody is now with the American diet is spread around the world. But it is a pretty natural state for times of famine for sure.
Yeah.
And it's a diet it's almost magical sometimes. I think it is.
I agree. I still have trouble trying to explain to people what amazing things can come, because it sounds like total snake oil. It sounds like you're
Right,
making things up
right.
that it's good for so many other things. And yeah, you get to hear stories about it all the time. Did you notice anything else, besides that optimism, but any like physical things that changed, or more satiety, less snacking, any of that other stuff
Oh,
that comes along?
definitely more satiety. Definitely more satiety. You don't want to eat that much, and you'd rather take the dog out, rather go on a hike, and then you come back and say, "Oh, and you're hungry though." When
Right.
you're hungry, which I never had been since food had always been around all day long. There was, no. So but people say you sleep better, and that I haven't noticed. So it's bits and pieces, but it was really that the blackness, the black despair that I could really fall into, in the mid 21st century, which I think a lot of people are falling into, and
Totally.
it's not what we need. I mean, there are, you can't not look at California fires. Things are real,
I
but you can't, it's just, it doesn't help to sink into just, this is awful, the
I
awfulizing.
I agree. I see that in people, and it's unfortunate because I see people spin around in that kind of depression, anxiety over world events that unfortunately, like, you can't control. Like, you didn't start the fires in LA, and yeah, it's awful to see. But like at the end of the day, you can't ruin your own life by spinning around thinking, what could be any different. You're just going to ruin your own experience. So I agree with that, and yeah, it's such a wonderful way of living and such a wonderful diet. For so many different reasons, if none else, and other than the mood improvements and the optimism and that kind of thing that you've
Yeah, which is
suggested. Yeah,
the mood optimism is such a wonderful thing.
it really is. It really is. Well, you don't seem to be slowing down anytime soon, especially now that you're in a ketogenic state. I imagine your energy is going to go through the roof.
Oh,
What
it's
what things
true.
are you
I am.
good?
I'm,
Good. What things are you planning on the future? How do you want to continue doing some of this work?
I don't know. I don't know. I really don't know. What I'd love to see is the science explained. Like how you said when Guido Frank got up there and was talking about, I think, because I sort of know how doctors work and they're going to keep it at arm's length. You don't even need to know exactly how it works, but you have to have a working hypothesis that talks their language. You have to talk about receptors. You have to talk about synaptic plasticity, and you have to have a reason for saying that. And I think I've actually been going to a few labs around here, and there are a lot of labs in Boston. So I do the same thing. I write to them. I say, "Would you be interested?" Most people are not, but somebody else says, "Why don't we come down and chat for an hour?" And I think one of these ways we've got to figure out more.
Yeah,
Like Chia Aoki's lab, but that's a little star in NYU.
yeah. Wow. Well, that's
And the
amazing.
Bazookies know that. And I think the Bazookies are funding basic research a lot now too.
Yeah, I think that'll be really helpful in getting Carolyn's story out. And again, the grant that she won, to know that that's going to be spread, so wide and is going to affect so many people is amazing. I'm so grateful for that family, so I could meet her and then eventually get to you and be able to hear your story. And this has been an enthralling conversation. I've thoroughly enjoyed all of this.
Thank
The
you so much.
history. Oh my
It's
goodness, the
been
history of
fun.
all of this is fascinating. Your book's amazing. Like, to get to know you and hear the story, and also appreciate, again, all the history and everything. It's just absolutely wonderful, Barbara. Yeah, where would you like people to go to find you and connect with you and your work?
You could just go to my email. It's my last name, first name at gmail.com. Or they can go to Anor-Exit, EXIT. I'm
I
on
have, sorry, go
the,
ahead.
there's a board there, an advisory board, and Guido's on that too.
Oh yeah, that's right. Yeah, that's a really challenging word to say, by the way. Anor-Exit. I have a tough
It,
time with that.
we've been told that the name should be changed, so we're thinking of that.
I think it's a great name. It's just hard to say.
And when
Well, Barb,
people Google it, it doesn't come up, but obviously other things.
yeah, well, that's amazing. Barbara Skolnick, this has been incredible. Like I said, such a wonderful conversation. I'm so grateful for your journey, and to feel like you'd been practicing for so long and hadn't made a huge impact, I'm sure is an understatement. I'm sure you were helping a lot of people in your own way, but to do something this meaningful later on, and potentially inspiring so many people out there, to think where this is going to go in the future, it's mind-boggling, and it is miraculous, and you're a huge part of it. And so I'm just so grateful for you and your work, and for taking the time to be on our show today. We really, really, really appreciate you.
Thank you, and I'm grateful to have been here. Thank
Well,
you
thank you
very much.
for appearing. It's been wonderful. And this has been another episode of Boundless Body Radio.